Hi there. My name's Melissa, and I'm a licensed therapist with Happy Moms Therapy. And that is my dog Cooper, and he'll be joining us today. So, today I want to talk to you about birth trauma. So, giving birth is quite the experience. While there are many ways to prepare for birth, it's one of those things that there's a lot that are just really out of our control. And unfortunately, about 45% of moms experience some sort of birth trauma. So let's dig in a little bit more to learn about birth trauma. So, what exactly is birth trauma? Birth trauma is the physical and emotional distress that you may experience during or after birth. This can include serious complications that put you or your baby's health or life at risk. It could include a lack of care support by your medical team, a lack of care or support from your partner or family members. It can be around not experiencing the birth that you wanted and expected. It can include an emergency C section, birth injuries to you or your baby, and also anything that like baby requiring medical attention after the birth. During the birth, you might have felt afraid, helpless, and unsupported by important others, such as your doctor, the nurses, your partner. Often afterwards, you may feel more numb or disconnected. And a lot of moms report feeling really guilty and feeling responsible for the experience, that there is something wrong with them and that they somehow failed at giving birth. So even if it turns out okay, the effects of birth trauma can stay with you for a long time. So, what makes a birth traumatic? Um, a big sort of like characterization of trauma is that it's not what happened, but it's how your body and your brain reacted to what happened. And this reaction to these events it's kind of out of our control. It's not something we can choose about how we react. So in order to understand birth trauma, it's helpful to understand more about trauma in general. So we are innately wired for our survival. This means that we have some sort of built-in automatic mechanisms that go into place when our brain perceives we're in danger. The key word here is perceives. So even if you're not actually in danger of losing your life, if your brain thinks you could be, then it can set off the survival response. And this is commonly what we refer to as fight, flight, or freeze. So when your brain sets off the fight, flight, or freeze response, there's some mechanisms that kind of like that basically start acting for your body. And some of these include your frontal cortex, which is this front part of your brain, and that's the executive thinking part of your brain. It will go offline. And basically, your more emotional, instinctual part of your brain will take over. Your stress hormones like cortisol and adrenaline will often surge in your body. And then this kind of creates different reactions to that. And that can include your heart rate increasing, your breath becoming more shallow and rapid, your muscles starting to get more intense, and then also your digestion slows. So when we are in fight, flight, or freeze, um, well, that basically this is really helpful in a real life or death situation when it requires our immediate attention and we need to do something immediately, or we need to freeze in order to get to safety or to be safe. However, in our modern day life, there's a lot of situations where we are experiencing a threat to our well being, but it's not necessarily a life or death situation that requires an immediate reaction. And in some cases, we can't really do anything about that. So, in the example of like a traumatic birth, you might have been very limited in what you were able to do. Maybe you had to have a C-section. Maybe you had an epidural and you really couldn't move. So there's a lot of things that, your body was going maybe in this fight or flight freeze response, but you were unable to do anything about it. And this can later create a lot of difficulties for us. One of the big things that comes up around trauma is that after it's over, we and the people around us often have this expectation that we sort of move on, especially if things sort of like worked out in the end. And so this happens a lot when someone experiences birth trauma, is that they went through this sort of traumatic experience, and then maybe, in the end they are okay. Baby is okay. And I'm going to say, generally speaking, maybe there were some injuries. Maybe baby did have to spend some time in the NICU, but overall, like it becomes okay. So there can be this expectation that we will be okay, that, everything worked out. So it's okay. Or you and baby are healthy. And that's all that matters. And so it can be really hard because while we may rationally recognize that, our brain is stuck in that trauma experience. For our brain, trauma does not end, it kind of keeps going. And so a lot of moms who, after they've experienced some sort of birth trauma, they report feeling, a lot of times they can initially, especially, they feel more like numb and disconnected. A little bit, sometimes maybe a little bit of like an out of body experience, or they're just like not very present. Again, they feel a lot of guilt that they did something wrong, that their body failed. A lot of times they'll say that that they should have done something to protect their baby, or it's very easy to look back in hindsight and say, oh, I should have done this. I should have done that. This didn't seem right to me. Why didn't I follow up on that? And all this stuff. Well, yes, after we have all this more information, we can look back and think those things. But in those moments, we didn't know that. And even so, even if we would have followed up, who knows what would have happened again. But again, there's this sort of replaying of all these things we could have done differently. And we take a lot more responsibility about that. And so it can be really hard that while maybe everyone else is sort of moving on, those that have experienced trauma can feel really stuck in it. The other thing is that there can be a lot of what we call triggers that get attached to the trauma. So when we go through trauma, our brain will kind of take a heightened sense and alert of everything that's going on during that trauma. So definitely sounds, smells, people, time of day, places, all sorts of things. Our brain can kind of take these and it will connect them to the trauma, and it starts to associate them to the trauma. So then what happens is then later on, when we encounter something that might be similar to those things that we encountered in the trauma, our brain will sort of set off the alarm that we could be in danger. Like, uh-oh, this is happening again, or this might happen again. You have to be ready. So for a lot of moms, they will have a lot of sort of trauma triggers of these things that they experience that kind of triggers them to have that kind of body experience of that high anxiety, that panicky feeling, and all that from what they experience in the trauma. So this can certainly impact your daily life. There's going to, like I said, those sort of trauma triggers that come up. Another thing that often comes up is, there is often like a grieving process of not having the birth experience that you wanted. That, and then with that, there can again be this guilt, like, I should just be okay. I should just be happy because I have my baby now. But instead they feel sad or depressed or disconnected or anxious. Because again, those are very common experiences or feelings that come up after trauma, but we feel like we shouldn't feel that way. So this can then lead to more shame. And then often, again, because we feel like something's wrong with us, or we shouldn't feel this way, we can get more isolated or kind of disconnected from our loved ones. Sometimes people, in order to deal with all these feelings that are coming up, they turn to other things to kind of help them manage it. And it's kind of some more what we call compulsive like behavior. So it could be things like using more alcohol, using food, emotional eating, shopping, spending money, buying more things. Um, that can happen frequently. Another thing you see is sometimes there's like a lashing out on people. So, maybe you're feeling all these things and then something small happens and you have like a really big reaction, especially with like your partner or loved ones. A lot of times after trauma, people will struggle in their relationships, with their partners and even with connecting with their baby. There can be a lot of just sort of a feeling of disconnection there, or feeling like they couldn't provide for the baby the way they wanted, and they are having a hard time connecting with them. You know, the big thing with birth trauma is that it does correlate or connect with higher levels of postpartum depression, postpartum anxiety. Birth trauma can lead to PTSD, panic attacks, things like that. So, if you've had birth trauma and you feel like you're having a hard time sort of processing through it, it can be really important to get therapy. So that kind of leads us to, how do we recover from birth trauma? And what's important to recognize is that we can recover from trauma, we can process it, and that it's something that we can get to the other side of feeling better. Um, and so it is really important to seek out more support for that. There are different ways for treating trauma. For some, it is helpful for them to tell their birth story. So, this can be something that you can do in therapy with a supported loved one. And there's also even groups of other women who've experienced difficult and or traumatic births where you're able to tell your story. Sometimes it can be helpful to write it out, or use some do process it through with some sort of art. For others, having a more intensive type of therapy to deal with trauma can be more efficient. And one of the therapies we like to do at Happy Moms Therapy to treat birth trauma is called EMDR therapy. This stands for eye movement desensitization reprocessing. Um, so that is a mouthful, but basically, it's a very highly effective type of therapy that was discovered and made to treat traumas. And what it does is basically it's just using the brain's own natural healing process to be able to get to these sort of trauma memories that are stuck and process through them in a way so that we can sort of move forward and be helpful. As I mentioned before, with trauma, it tends to get stuck, and then how our brain reacts is if the trauma is not over. And so that is where we keep getting kind of triggered, um, because our brain keeps thinking that this trauma is not over, the danger is not over, that this is it could happen again very easily. When we use a therapy like EMDR, it's helping the brain recognize that this trauma it's over, it's completed, and it also helps the brain sort of recognize that, like, it can take out things from it that have been okay, or that were positive, or the ways that we can look at it differently. Um, it's just sort of amazing. I love EMDR, and I think it does amazing things of helping people feel better when it comes to their past trauma. So, if you've had birth trauma, or even if you've had other traumas in your life, I would highly recommend to seek out EMDR therapy. So, as I mentioned, birth trauma is actually pretty common, with up to 45% of moms reporting that their birth experience was traumatic. Birth trauma can really have a big impact on you, on your day to day. And unfortunately, it is often connected to experiences of postpartum anxiety, postpartum depression, and also PTSD. So, if you had some sort of traumatic experience with your birth, I would highly recommend for you to seek out additional support, especially in the form of therapy. So if you're in California and you're interested in our services at Happy Moms Therapy, I would love for you to reach out. We offer a free consultation and we can talk more about what your needs are in therapy and how we work and see if we're a good fit. So if that's something you think you want to go, would like to check out, please look in the notes of the video and you can find a link to my website where you can schedule that consult. So anyways, I hope this video was helpful and definitely follow us for more and wish you the best.